Good afternoon, everybody. And let me first begin by thanking all of you for everything that you're doing on behalf of kids and to your associations. We put this together pretty quickly. And I want to thank, I see Dave on here and his colleagues and the other statewide superintendents associations for all their help and cooperation. And as a parent of two high school boys and two middle school boys, I see my superintendent on here. We can't thank you all enough for what you're doing. Children and their healthcare providers, both pediatricians and children's hospitals, are facing a perfect storm. There's the COVID Delta variant. There's unprecedented seasonal allergies and respiratory conditions we're facing. Behavioral health census, inpatient, outpatient is at all-time high, and we're facing a staffing crisis. This prompted our CEOs 2 weeks ago to issue an open letter to Ohioans outlining some of these challenges. But more importantly, really asking Ohioans for their help. Ohioans always rise to challenges, and we know that vaccines work if eligible. Masks are helping keep kids in school, and that is our number one goal. I think everyone can agree our priority is kids in school, in person, 5 days a week. We're encouraging all Ohioans to use those tools I mentioned about, if eligible, get vaccinated. And we're urging all superintendents and districts to consider adopting a temporary masking requirement for K-12. We'll talk about some of the data we're seeing and the efficacy of that, and that'll be covered by our clinical leads. We have Paula Grebe from ProMedica Russell J. Eide Children's Hospital, Marlene Miller from UH Rainbow Babies, Rob McGregor from Akron Children's, Rustin Morse from here in Central Ohio at Nationwide Children's, Adam Mezoff from Dayton Children's, and Patty Manning from Cincinnati. As Sarah mentioned, we're recording this and we'll make it available should any of your colleagues not have been able to join, and we'll prepare an FAQ as well. But before we hear from the clinicians, it's my real pleasure and honor to welcome and introduce Governor Mike DeWine. Governor.
Hey, Nick, thank you very much. Thanks to you and children's hospitals across the state for hosting this. They are, you guys are some of the most trusted institutions that we have. You're our go-to people for information about medical situation with children. So thank you very, very much for doing this. I think everyone does agree that our goal is to keep kids in school, and we all have a common goal. And, we may have a lot of things that pull us apart in regard to some of these issues, but I think that the vast majority of Ohioans think kids need to be in school 5 days a week. So thank you again for doing this. To the superintendents and other school officials, thank you. You've had 18 months of very, very difficult time, and I'm very grateful for what you do. I know it's not easy. I know it's very, very tough. And so we want to really thank you for that. I talk a little bit about our purpose today. I know that a number of you have reached out to your local children's hospitals and had questions. I know you also have questions in regard to quarantining. You have other questions. So you're going to hear today from our different children's hospitals around the state. They're going to talk a little bit about what they're seeing, what the situation is. But the majority of time is going to be spent with your questions and those answers either from the health department or from the children's hospital. And Dr. Vanderhoff is on here. He's going to stay on here and be available if you have particular questions. But also, of course, all the children's hospital folks who are going to talk, they will be here available for questions. Let me start with kind of a little bit of where we are in regard to this Delta variant. And let me just start by citing, I just checked our numbers, and these are as best as we can tell. And as you know, the Children's Hospital has been asking hospitals have been asking schools to mask K through 12. I have done that as well. As of today, 46% of our students, public school students, go to a school district that requires everyone to wear a mask. That's a significant change over where we started when school started back up. So as of today, 46% of our students go to a school district that requires everyone to wear a mask. 15% of our students go to a school district where some of the children, usually the younger ones, are required to wear a mask. And if you break that down by population, the best that we can tell when you factor in the schools that are partially masked and account for those kids and break that out. If we look at the total students today who are required to wear a mask, they constitute, we think, about 54.4% of total public school students. So that just gives you an idea. Now, those numbers obviously are not school districts. The school districts would be much less. But breaking it down, just the number of students that are now required to wear a mask, we think it's about 54.4% as of this morning. Let me go from there, though, to talk very briefly about where we are with Delta, and just to give you some basic facts. And I think this is important because, to state the obvious, your school district is in a community. And sadly, there's no community in the state of Ohio that is not red hot today with this Delta variant. It is all throughout the state of Ohio, and you live in that community. Your school district's in that community. Your kids are from that community. So I think is important to look at where we are. Let's look first at the increase in hospitalizations. In the first week of July, we had 203 people in Ohio's hospitals with COVID, 203. Yesterday, that number had gone to 3,427 people. That is almost a 1,600% increase. That's what this Delta variant has done. And just yesterday, there were 344 newly reported hospitalizations that were reported. Let's look at the deaths. Deaths are lagging, but we can give some indication of that. In regard to deaths from COVID, we've seen deaths increase in the state during the Delta surge, with 28 Ohioans dying from COVID in the first week of July, when we started seeing cases increase as a result of Delta. During the last week of August, 147 Ohioans died from COVID. And again, that's over a 400% increase. If you just look at cases, they are increasing everywhere in the state. Frankly, every county is red hot. Some are boiling over, but everyone is just hot. Whatever county you're in, there's frankly no place to hide from the COVID. Every school district is surrounded by numbers that are very high. Just a couple numbers. Our statewide case rate per 100,000 is now 664. Just absolutely phenomenal. 23 counties have a case rate above 1,000. You remember, if it's 100, that's what the CDC considers to be high incidence. So our state average is almost 7 times that. 23 of our counties are over 1,000, which would be 10 times. Every county in the state has a rate of at least 340. So even the lowest county is at 340. So very, very, very high numbers. Let's look at specifically what's going on with children. Since August 15th, over 29,000 Ohio school-aged children have had cases of COVID. 29,000 since August 15th. Cases have increased almost 200% from the week of August 15th compared to the week ending September 9th. So we've gone from about 3,300 to over 10,000 in that period of time. Relative, it's basically 2 weeks. Let me give you some other data. The American Academy of Pediatrics just reported yesterday COVID cases among children have increased nationally 240% since early July, when the Delta variant started to surge. During that same period in Ohio, though, we've seen a 2,000% increase in cases among children, a 2,000% increase. COVID cases are increasing at nearly twice the rate among school-age kids as compared to the rest of the population. This past week, we saw a 44% increase among school-age children and only a 17% increase among the rest of us. Over the 2-week period ending September 4th, there was an average of 909 cases per 100,000 for school-age kids. For the rest of us, the rest of the population, that number was only 561. So much, much, much higher among our children. The 16 highest number of cases per day, just taking one day, the 16 highest number of cases per day throughout the entire pandemic for children aged 5 to 17 in Ohio have all been in the last 19 days. So just absolutely phenomenal numbers. And let me just close with this. Further, the data is showing us that there is a higher level of COVID in school districts where masks are not required. And we are seeing that. We're following it every day, but that clearly is emerging now. Let me now go and turn it over to Children's Hospital. I'll go back to you, Nick. And again, we anxious to hear from what our experts from our Children's Hospital have to say. And again, thank you, Nick, for doing this, and to everyone from our Children's Hospital who's on today. Thank you very much.
Thanks, Governor. We'll go through our clinicians, and I would ask them to please try to keep their comments brief. We could obviously talk about this all day, but we want to be of maximum use to the superintendents. See, people are filling the chat box up with questions. Please keep those coming in. We're going to begin up in Northwest Ohio with Paula Grebe, who's Chief Nursing Officer for ProMedica Health System and Vice President for all patient care at ProMedica. And she is at Russell J. Ebi Children's, as well as her many adult hats. So Paula knows what she's talking about. Paula?
Thank you, Nick. And a great big thank you to Governor DeWine and all of you from the superintendents for meeting with us today. You know, as Governor DeWine was walking through these points, I was simply shaking my head as we went along. Here in Northwest Ohio at Ebi Children's Hospital, we are seeing record numbers of kids being admitted to our hospitals. We are really sitting at over 100 kids in Ebi Children's Hospital over the course of the last several weeks. And that is truly unheard of in the summertime hours, predominantly related to a significant increase in respiratory illnesses like RSV, parainfluenza, and certainly some COVID. We're averaging 3 kids or so a day admitted to our facility that are COVID positive. When you look at where we sit from a increase in positivity rate for children who have been tested, for the week ending on the 11th of September, our kids under the age of 17 are sitting at a positivity rate of 12.7% of those we test are positive. That's up from less than 2 months ago of a rate of about 2.5%. So a market increase for us. We have seen impacts in our behavioral health world with rising volumes of kids who need assistance from a behavioral health perspective. Certainly, our physician practices, our urgent cares, and our EDs have been overrun by volume, both on the adult and pediatric side. And I'm going to share a story with you all. Last night, we truly had an unprecedented event occur in Lucas County. At 10:36 last night, every emergency department in every hospital in Lucas County was on EMS bypass, including our Children's Hospital, including ProMedica Russell J. Ebi Children's Hospital. I've been in this business a very long time. This is the first time any of us have any recollection of that type of an event occurring. What does that mean to our folks? What that means is when you go on EMS bypass as an emergency department, our ambulances can no longer come to your facilities for those very sick, very acutely ill children and adults who need assistance. They must bypass you and go to the next facility. When every acute care emergency department in the entire county is on EMS bypass, that's just unprecedented and scary and frightening for our communities and the people that we serve. At that point in time, our county calls a code red alert through the EMS Toledo and Fire Department, and they simply begin to distribute EMS runs, ambulance runs to every facility one at a time around the course of the county. So you may not go to the facility nearest your home or the one you choose to go to or the one that's best suited for your needs. You simply go to where the county directs you because that's the next group up that's able to take an ambulance run at that point in time. Again, unprecedented for us to have these events. Why do we go on EMS bypass? It's predominantly because your emergency departments are overrun sheer volumes of people and unable to sustain that load. And your inpatient facilities are very, very full and you're out of beds. And those situations existed for us last night for the first time in the history of what any of us can remember. That situation lasted for us roughly 8.5 hours or so before we were able to actually begin to open up our emergency departments and resume normal business. Again, I think it's really important just to point out this was a county-wide issue. It wasn't just our Ebi Children's Hospital or our ProMedica Toledo Hospital. This was every emergency department and every hospital in the entire county. So we know how to keep our kids safe. We know how to have a reduction in the number of children that are impacted who need to seek services, and we're requesting your assistance to help us with those events like mandatory masking. Thank you.
Thanks, Paula. We're going to move across the North Coast over to Dr. Marlene Miller, who's pediatrician and chief at Rainbow Babies Children's Hospital.
Thanks, Nick, and thank you, Governor DeWine, and to all the superintendents. I can't think of another moment when we, the children's hospitals, need to partner with you to keep our children safe and keep them healthy. A little bit about what Rainbow is seeing. First, talking about our testing rates. We have just in the last week alone seen 24% increase in our positivity rate. We now are 11.2% of children that have symptoms end up being positive. That was only 9% a week ago. Even asymptomatic children, what we are seeing now is 1 in 20 children that do not have symptoms are testing positive for COVID. That's again astounding, our highest number since the beginning of the pandemic, well over a year and a half ago. When we look on the inpatient side, we have seen our highest numbers ever. We have right now 6 patients in, but we were just very recently at 10 patients hospitalized with COVID children. And this is not counting other respiratory viruses, as Paula mentioned, that are also surging unexpectedly now and causing really high hospitalization rates at a time when we're typically not seeing them. Our ER saw a record number of patients yesterday alone. Our urgent care saw a record number of patients. Vast majority of these are sick children. And I just told you our positivity rate. So the overwhelming diagnosis is COVID. We have an extensive network of about 160 employed pediatricians, and their offices are being overrun. I've talked to many of them, and they are filling up their days and have no more room for parents calling with another sick child to see the pediatrician. So as often as we know that most kids don't get terribly sick, we also have to think about the pediatrician and those children that aren't that sick, where the parents need assurance, testing, examinations to assure that their kid is okay and can stay at home. And our pediatricians are being overrun. And I think we need to factor that in as we think about why do we want children to be masked. It's because even if they don't get so sick they need a hospital, we are still outstripping all of our healthcare resources, from the pediatrician's office to the urgent cares to the emergency rooms, let alone hospitals themselves. I will add, when we look at all of our patients that are sick enough to come into the hospital, they're either in 2 categories. They were ineligible for a vaccine because they were too young, or they were coming unvaccinated because they were coming from an unvaccinated household. That is the overwhelming story. I know you've seen that on the adult side, but it's holding true for children too, that the children that are getting sick either can't get the vaccine or haven't chosen to get the vaccine yet. So I really welcome you partnering with us. I think we have a path forward. We do want to keep our kids in schools, but we need to keep the social distancing. We need to have all these children K through 12 in masks, and we need everyone that can to get vaccinated to try to really curb that tide and keep our kids in school and healthy, which is what I know we all want. Thank you.
Thanks, Dr. Miller. We're going to move to Dr. Rob McGregor, CMO at Akron Children's. Dr. McGregor and his colleagues have some interesting data that they've seen in Summit County on schools that have masked and schools that have not yet adopted. Dr. McGregor?
Well, thank you, Nick, and thank you. I'm grateful to have this audience because I think this is really, I've been a pediatrician for lots and lots of years, and this is really a critical moment. At Akron Children's, today we peaked 18 patients with COVID and 5 intubated patients with COVID. That is more than we've had in any 2 to 3 week period since this pandemic began. And regretfully, we also have filled our ICU, fully staffed, but filled it and overflown into our burn ICU. And at this point in time, we currently just had to divert a teenager with COVID pneumonia. That is not something that I ever want to happen to your family member or my family members. I think you need to be able to get access to your children's hospital closest to you that will be best for all concerned. And if we don't really slow down this curve, we're in trouble. But one of the things that is fascinating that we learned last week is that my hospital is located in Summit County, and we had additional hospitals in the Mahoning Valley. But in the Summit County Public Health reported last week that of 10,070 kids from our local schools were quarantined since August 16th. Of that 1,070, only 23 of them were from schools where there was a mask requirement. Since that startling statistic came in, I'm grateful to say that Summit County was able to pivot, and almost all of our schools have now gone to a mask requirement and had a 72% decrease in the number of student quarantines since September 6th. So again, that works. I saw in the box, we mandate a mask during school, then they go out and play. Well, these kids were going out and playing, and there was a distinct differential. So I think that there's no doubt that when you're in a close quarter for a long period of time, the transmissibility is even more likely. And I think we need a break, if not to, I think I saw something about, well, we could do it for a month or two. We can't do it for a year. I would be grateful for a month, because that would allow us to then make sure we are decompressed enough to have space should your grandchild or child need services or someone that you care about. So I think that this is the real deal. It's very disheartening that we've gotten into this spot. In addition to all of the issues with COVID and the sicker kids with COVID, there have been COVID deaths. Kids don't usually get them, but how many deaths matter? It is really critical for us to partner with you and at least stem this curve, and then reassess and see what kind of benefits we've had. The numbers at Summit County spoke for themselves, and fortunately, the school districts were able to make that pivot. Thank you.
Thank you, Dr. McGregor. We're going to move to Central Ohio, also representing Southeast Ohio, Nationwide Children's, their Chief Medical Officer, Rustin Morse. Dr. Morse.
Thank you, Nick. Thank you, Governor DeWine and the superintendents. I appreciate the opportunity to speak to you again. I spoke to you guys a few weeks ago about recommending that we mask in schools, and now I'm coming back with a much stronger message. I can honestly say I think our health systems across the state are in crisis. I was on a call with other hospitals, adult hospitals this morning across the state, and to hear them say they have no beds for patients, they have the inability to care for the patients coming to the emergency department, they're holding pediatric patients with behavioral health concerns and no place to transfer them. And it is a sense of panic in their voice. They don't know what to do. I've been reading the chat as well. You're short bus drivers, these hospitals are short nurses, and they cannot care for the patients. So we're in this critical situation where if we don't do something together to bend this curve and reduce the burden, the health burden on the systems, Ohioans unnecessarily are going to die. I can confidently say that the system is at its breaking point at this point. So we need to do something, and what you have the power to do, and it's not easy. I've been reading the chat. I know you're in a difficult position, but if you uniformly support masking and encourage and require masking, at least for a 4-week period in your schools, you can help play a role in stemming the tide of what's going on. It may not be the only thing that needs to get done. It doesn't fall strictly on the superintendents. I know Mayor Ginther here in Columbus issued a mask mandate indoors. So we all have to do what we can do together to try to get this under control. Just to give you a sense of the current state here, I walked in this morning, we had over 20 patients waiting in our emergency department to be seen. The emergency department was full, and those patients have been waiting upwards of 10 hours. 10 hours in the emergency department waiting to get seen. We saw over 1,100 patients in our urgent cares and emergency department yesterday, which is at least 300 to 400 more than we typically would this time of year. Today, we have 30 children in our hospital with COVID, symptomatic with COVID. Those who are eligible to be vaccinated, none of them were vaccinated. Those are preventable hospital admissions. 10 of those children are in our ICU. 5 have breathing tubes breathing for them. So they are on life-sustaining support with breathing tubes. Just prior to this meeting, we have 100 patients in our emergency department and urgent care on our main campus. 65 of those are in the waiting room waiting to be seen. We cannot get them in. It's just backing up. It's like the dam is broken and we can't keep up with the flood of patients. Our behavioral health pavilion, our psychiatric hospital, is completely full, and we're having to turn away patients who are asking for resources across the state. And it's not just the children's hospitals. The pediatric offices, as someone spoke earlier, said, are overwhelmed, and the adult hospitals are overwhelmed. So I know it's hard. I know this is a difficult ask of you, but temporarily requiring masking for a 4-week period will help us get through this together. It's not the only thing that we need to do, but it's the thing that you have power and control to help us influence. Thank you.
I'm going to move down to the Miami Valley now to the Chief Medical Officer at Dayton Children's, Dr. Adam Mezoff. Dr. Mezoff.
Thank you, Nick, and thanks to the governor and his office and all of you for being a part of this and for allowing us to share some of this information. I want to start out with a little bit of our information and then support and maybe share some other thoughts on where we are and what we need to do in our region. It's hard sometimes because some hospitals are much bigger than others, but suffice it to say, in our region, we're seeing the same overwhelming number as others. This morning, early in the morning, we were boarding patients in the emergency room, which meant our hospital was full and we had no beds to put kids in. So we had to park them somewhere until we could find a place to put them. You know, in other circumstances, one might say, well, we partner well with children's hospitals. Why don't we just send them somewhere else? Well, all of the hospitals on this call are in the same situation, which is they are hard pressed to find any extra room in the inn to help these kids get better. On average, we had 0, maybe 1 COVID patient in our ICU in August. In September, about 40%, and we have a 24-bed ICU. Often it's at least 3/4 or more full. Up to 40% of those patients are COVID patients now. I'd like to sort of point out a few other things. One is, as we ask for support in masking, and we will do everything in our power to get out in front of it, to partner with you, however that helps you. I want to remind you that it's not just COVID. So we're being overwhelmed with respiratory viruses that typically do not occur at this time of year. I know everybody has said they've been in pediatrics a long time. I've been in pediatrics for 40 years and I have never, ever seen anything like what I'm seeing now. And we had this discussion right before you all got on. We are people who are calm in the face of a storm, but we're scared. And I don't want you to think we aren't. Every doctor on this phone call is afraid because we are now starting to see our system being overwhelmed with patients that it is not in our DNA to turn away, and we have to figure out a way to help them. I want to also remind you that we have a large amount of staff that have children. So when those children get sick, we lose more staff, and we can't manage the volumes we're having now, even with full staffs. When you throw on top of that kids getting sick and parents staying home because their kids are sick, it again speaks to the perfect storm that Nick was alluding to. All of these are factors in why we are requesting that we find a way to partner together, at least temporarily, to have kids protected with masks in school. We have data to show that despite the fact it may not seem like they maintain masks when they're out of school, that there clearly is a benefit and a lower percentage of kids getting sick or staying at home when they do that. So again, let us get through this crisis situation together for at least 4 weeks and see how we look on the other side of things. And again, I appreciate your time and happy to answer questions later.
We're going to conclude the docs and then we'll get to the Q&A with Patty Manning. Dr. Manning is the Chief of Staff at Cincinnati Children's Hospital. Patty.
Thanks, Nick. Thank you, Governor, and thank you all to all the superintendents. I know the work that you're doing is not easy. Just like all of us, you are in the trenches and you are facing all kinds of tensions around what we're asking you to do. So I'll just share numerically everything that you heard from the rest of the state we're experiencing here in Cincinnati. We're at our highest number of positive inpatients. We're at our highest number of patients in our ICUs. We're at our highest number of patients on ventilators, all with COVID. And it is breaking our system. Our EDs, our urgent cares, our primary care centers, all of those clinics are overrun. And when our pediatric healthcare system is at the breaking point, as we're telling you that it is, That doesn't just affect children who might have COVID. And I get that people think that kids with COVID don't get sick, and we'll talk about that in a second. That affects the healthcare of every child in Ohio. Everyone's healthcare is impacted when our systems are at their breaking point. If your child is in a car accident, God forbid, if they have cancer, if they have a developmental disability, if they have a fracture, their care will be impacted because we are overrun, because this experiment that we are doing, and I want to speak to this question of why can't we just let the kids get sick? Why can't we just let the kids get sick? We're sort of doing that. We're living that, and it's not working. What happens when we just let the kids get sick is our systems get overrun as they are, and the healthcare of all children are impacted. We have two pathways out of this pandemic. One of those pathways involves using tools that are safe and effective, and some of them are incredibly benign, like wearing a mask. And that reduces the number of people who get sick, whether it's kids or adults, and it reduces the burden and the dangerous deluge of patients on our healthcare system. That's one pathway. The other pathway is what we're doing right now. Let kids get sick, let people be unprotected, and let our systems get overwhelmed. And I have to tell you that I choose the pathway where fewer kids get sick, fewer kids need our healthcare systems, and fewer kids die. And I would hope that you all could make that choice as well. And we need you to make that choice. We understand that there is tension around who should make this call. We understand that you are being faced with school boards and communities that are in great disagreement about some of these decisions. I don't understand why we're letting the loud voices of a very vocal minority, and I am convinced it is a minority, dictate what happens to the health and safety of the rest of us. We can't handle that here in the Ohio Children's Hospitals. We need decision-making to happen. We need it to happen at the local level. You all are empowered to make these decisions. Finally, I'll share with you some additional data around the impact of masking, because I've seen these questions in the chat. Here in Cincinnati, we did an analysis of around 7 school districts, some of whom were partially masked, some of whom were fully masked, that served over 64,000 kids. In the partially masked districts, the kids were almost twice as likely to test positive for COVID, not be quarantined, to test positive. These are kids who are getting sick because they're in districts with partial masking or no masking mandates compared to the districts where kids are masked. So if we're all okay with twice as many kids getting sick, and some of those kids getting hospitalized, and some of those kids being on ventilators, and some of those kids dying, then that's the strategy we can pursue if everybody can live with that. I can't live with that. And I think we need to do something now.
Thank you to all of our clinicians for sharing that. And we're going to get right into the Q&A here. And I'm going to kind of just grab the bull by the horns. I think the number one question that everyone is wrestling with is, can and should the state enact or require a statewide mandatory mask mandate? And I want to just talk briefly about this, and I'm sure the administration may want to jump in. We have been, like all of you, briefing our elected officials in the Ohio General Assembly on these same data points. And I think it's also important to share that I saw in the chat a little bit that we have, you have governing boards that you're responsible to just as we do. And we are very willing to share this presentation, to do this presentation with anybody that you would recommend we do so with. And so that's just something that occurred to me, Governor and superintendents, where we're talking. The school boards may want a similar one. We can cover that in a minute. But due to some changes in state law, principally Senate Bill 22, where we are in September 2021 is much different than we were in 2020. And recently as well, you saw that the president issued a series of COVID-related measures that, frankly, people are still, as I know you are, trying to understand that impact and trying to mesh together where state and federal governments ultimately can, make decisions in this space. It's our belief that if the governor and or Director Vanderhoff were to issue a statewide mask mandate for K through 12 schools, the legislature, as is their right under the Ohio Revised Code and current law, they could and most likely would overturn that. And the risk that would have to those of you that have already taken positions to adopt a temporary mask requirement, we feel more kids would be put at risk. So we're interested in trying to find solutions that are going to help kids now. As you've heard, the crisis is now. But let me just pause there. Governor, this is unscripted, but let me turn it to you if there's anything else you'd want to add on that. I think very important question in everybody's mind.
Nick, I think you've described it very well. Let me be real clear. If I could issue that order today and I thought that order would stick, that it would stay on, I would do it. In fact, I would have done it before today. I know it's difficult for you. I know that you have to deal with whatever constituents are in the community. It's tough for the school board. Last year, you didn't have to do that because we issued the order. But what has happened is we've changed, the law has been changed. Senate Bill 22 was passed. I vetoed it, and my veto was overridden, as the legislature has the right to do. So I can issue an order, but it's clear to me that that order would be overridden in a very short period of time. The legislature can do that immediately. And so it's clear where the legislature is, at least the majority of the members of the legislature. So if I did that, and it then was overridden, which it would be, we just have more confusion. And my concern is that what people would hear then is no mask mandate, and we would have a retrenchment even from where we are in our schools today. So I take the world as I find it. That's the way I find it today. That's the way it is. And so what we can simply do is to appeal to you. You can make those decisions. Your decisions can stick. I don't have the ability to do that and to make it stick. You do. And so this is what you've heard. I'm not the medical expert. You're hearing from the medical experts. But if you can do this on a temporary basis, I think it's going to, I think the experts are saying, every expert I've talked to says it's going to make a big difference. And, we're convinced it will make a very big difference. But that's why I'm not doing it. It's not an alternative. There's been some discussion about, it would be in effect for 30 days. My reading of that and my lawyer's reading of that is that's not true. We could put an emergency order on, but under Ohio law, the emergency order doesn't do much. It has to do with not having bids on contracts and things like that. The order that we put on last year was a health order on masking. And it's very, very clear that the legislature has changed the law in that area, and they could immediately override that when we did that. And the confusion that would follow in your districts, and I think it would be a big setback, frankly, for us. Big setback, and we don't have time to have a setback. So, Nick, that's kind of where we are. That's why we're here today. Frankly, that's why this conference is taking place, because we want to inform you, and the children's hospitals want to inform you. I've gotten a lot of briefings over the last 3 weeks from the children's hospitals, and I will tell you, each time I get one, it's worse. And each time I get one, I think I need to share that. We need to share that with our schools. We need to share that with the people of the state of Ohio. So we're going to do that at a 3:00 press conference, but we wanted to do this with you where you'd have the opportunity to ask questions. Thanks, Nick.
The other, before I turn to Sarah, I think several people were asking, could we share something in writing that captures what we're sharing with you here today? And the open letter that our CEOs penned 2 weeks ago, we can make sure that's available to everybody. But it talks about the importance, of course, of getting vaccinated if you're eligible, wearing a mask, especially in school. And I think the key thing here for us is temporary. So, Sarah, let me turn it to you. And if you could kind of tease out a few of these questions, that'd be great.
Sure. Thanks, Nick. So there are a few questions about follow-up information. To Nick's point, we will be sharing those follow-up materials and some of the statistics that our clinicians have provided you all today. We can absolutely pass that along so you can use that as materials with your individual school boards and otherwise. There is a question about specifically to the rates of children positive for COVID in the last few weeks in school with mask mandates in comparison to areas where students are not mandated to wear masks for the same period of time. Dr. Patty Manning, do you mind taking that? Because I know that you referenced that earlier, but just to be clear that some of those rates you were describing were not just with regard to kids who had been exposed and were looking for testing, but those rates of positive cases.
Yeah, sure, Sarah. So that's a great question. It really is the question of the day in terms of demonstrating efficacy of masks, although I think it doesn't matter what we say. In some circles, people don't want to wear masks no matter what we say. But what we found in that analysis of 64,000 students was about students being twice as likely to test positive if they were in partially masked districts versus fully masked. I don't know that we have an analysis yet of unmasked versus masked districts, but you could extrapolate very appropriately from that analysis that we did to say that the risk in fully unmasked districts would be even higher in terms of COVID positivity. But that's an analysis that we'll have to look at and see if we can get to you. You know, we're happy, I think all of us collectively across this, your screens here and the state of Ohio, we have tremendous bandwidth when it comes to doing analysis. But I have to say, I'm not convinced that more analysis will sell this to certain constituencies. But we're happy to do it if you think it'll help.
Sarah, next question.
Thanks, Dr. Manning. Governor DeWine, Director Vanderhoff, we've received a couple questions and comments about bus driver shortages that school districts are facing. And there's a reference to other states having the National Guard driving buses as a temporary solution. Can you respond to that?
Well, this is the first I've heard of, a possible request for the National Guard to do that. We need to hear directly from the schools. And, maybe someone on our team has heard that, but we can certainly look at that. We can look at any number of things. We know that there are shortages. We have heard about some shortages in regard to bus drivers. So if that school can contact us directly, we'll see if there's anything that we can do. I can't promise that the National Guard can do that, but we will certainly work with you on that, just as we will work with you on anything that you need.
Sarah.
Thank you, Governor. And Director Vanderhoff, this might be a question for you. There's some questions around the pilot program that's being developed in Warren County and districts wondering the status of that, if there's an opportunity to join that.
Well, thank you. It's a very good question. It's certainly one that we've had people reaching out to us regarding. First, I want to remind everyone that while we understand and strongly support the importance of quarantine, remembering that quarantine and isolation are really about identifying people who are sick or who may have been exposed to a sick person and creating separation that keeps them from spreading the illness to more and more contacts, and that these are tried and true methods. And then recognizing that Ohio's approach to quarantine has been one that has recognized the power both of vaccination and of the mask in terms of protecting people, and has created pathways that allows the vaccinated and those who are masked to remain in school. Well, on top of that, we were approached by educational and public health leaders in Warren County who were interested in innovating to allow for additional ways to potentially keep kids in school. And in working with them, we have developed a science-based alternative pilot pathway to applying the principles of quarantine, but doing it in an alternative way that allows kids to stay in school. But while this pilot, it's one that we have a lot of optimism for and a lot of hope in, it is a pilot. We are, frankly, still in the process of working out the final details of what that will look like. It relies on masking and frequent testing to keep kids who may have had an exposure in school. It's premature at this stage for us to offer that more broadly. We need to see that a favorable outcome, which is what we expect, is in fact what we see. But rest assured, we stand poised as soon as we have a good indication that this is having the desired impact to make it more widely available.
Let me just add to that, Dr. Vanderhoff, a couple things. In January, we purchased 2 million what I call quick tests. And we didn't know where we were going to use them, but we had the ability to buy them. We thought we should buy them. We have been making them available to our local health departments. We have been making them available to our libraries. And the demand for these has gone up dramatically, as you can imagine, in the last month. It started off, there was very little demand. These are tests that, average person can conduct themselves. So we have those available. Dr. Vanderhoff described what's going to happen in regard to Warren County. They came to us with a proposal. We said, let's try it. And we're now in the process of getting ready to try it. If in fact, it turns out that works, then we certainly can expand it. But we're a number of weeks away in all likelihood from finding out whether or not that will work. If it works, it will take obviously vigorous testing of those individuals, those students, and of course the students would have to agree to that. Parents would have to agree to that testing.
There have been a couple questions in the chat about our children's hospitals, as OCHA, talking with our state legislators, and just want to be clear, our legislators are great supporters of children's hospitals and children, and we have been regularly talking with them about the phenomenon that we're sharing with you. And we also understand that as we speak, our individual children's hospitals represented by the clinicians on the call here today are scheduling regional calls with their local delegations to re-impress upon them how the crisis continues to grow and expand and why we're asking for what we're asking. So that is ongoing and continuing to occur. Sarah, next question.
Thanks, Nick. We're receiving a couple questions about reinfection rates among kids, what we're seeing if there were children who had been diagnosed with COVID last year, and if we have any reinfection rates. Dr. Miller, do you mind if I turn that to you? Do you have any insight, or any other clinicians on with us today can comment on that?
Well, I think I can start, but I will tell you that I don't think we've had enough time to really have, a ton of thorough data on this. This is a really complicated question, and we do know if you look at the adult data and across the world data, there is a reinfection risk. I think that's why even if you've had COVID, the recommendation is to get the vaccine. Even if you've had COVID, the recommendation is to wear a mask, right? And that's what we are asking for. I don't think we should tie ourselves to making indecisions with all of the number of different data questions that we can ask. The recommendation is the same whether you've had COVID in the past or not. And that's what we're really seeking here, because I don't think the nuances of these reinfection rates is going to change in any way what our recommendation is. And that's what we're trying to focus on here.
Yeah, this is Bruce Vanderhoff. One of the things I think I can add is that if we look at the recent reports came last week in MMWR, which is CDC's research publication, it's relatively clear now that vaccinated people post-infection are almost 2.5 times less likely to have a reinfection than people who have not been vaccinated post-infection. So not only is there a reinfection rate when you've had a prior infection, but if you layer on top of that vaccination, it further reduces that, despite the fact that you presumably do have some degree of immunity from the infection.
Thanks, Dr. Vanderhoff. We received a question asking what percentage of Ohio school-aged children are being admitted to children's hospitals?
Too many?
Yeah, hard to provide that today. I think that's part of the data coordination we're working with state, ODH, the Ohio Hospital Association, others. One death's too many, and it's I think is the numbers aren't huge in terms of inpatient. The message we've been trying to import with people is that tens of thousands of Ohio children who have tested positive. and the fact that this is largely preventable if we can get them vaccinated if eligible. And again, masks are not the panacea, but they do help. And if our number one goal, which we think everyone can agree with, to keep kids in person, in school 5 days a week, those tools do work. So we'll try to get more of those data for you. But I think Adam said it well.
Nick, if I could add, just to chime in again, yeah, something else to bear in mind is why the absolute numbers of children who are getting sick enough to end up in the hospital or in the intensive care unit is in fact relatively low. We have to remember, for the most part, these are kids you wouldn't expect to have landing in hospitals or intensive care units under normal circumstances. These are, for the most part, pretty healthy kids who have now been struck down by this illness. And the tragedy in all of that I think was described very well by my pediatrician colleagues, is that the tragedy is that there are ways that we know we can dramatically reduce the likelihood of that happening to them. And what we're calling for is for people to apply those methods, both vaccination and masking.
Sarah?
Thanks, Dr. Vanderhoff. And there is a follow-up question on that percent. I do believe that last week we had over 1,400 children in the 0 to 17 category that had been hospitalized. And obviously these numbers are changing daily and we're seeing an acceleration, but that is the most recent figure from the statewide dashboard that we have filed.
Hey, Sarah, it's Adam, and I apologize for interrupting, but I want to emphasize something. The total number, I get it. It's a good number to have, but to me, the more important piece is we're being overwhelmed. As Dr. Manning pointed out, when that happens, routine care now carries with it an extra risk because of all the things we have to do to manage this crisis situation. So it's the total number itself will be lost somewhere. But what can't be lost is that every region in the state is having the same problem. We are overwhelming our ability to meet the demand that is out there.
Patty Manning, Dr. Manning, can you expound on our the good news we expect to come with ages 5 through 11, and then the other thing that is terrifying or mildly terrifying, which is we don't know about flu? I think those are two other data points.
Sure. Thanks, Nick. So there is a question in the chat about the timeline for vaccine emergency use authorization for children aged 5 through 12. We're very fortunate here in Cincinnati to do a lot of that research on the Pfizer vaccine. And so we're hoping that in the next couple of months, that vaccine will be made available under emergency use authorization for that age group. Now, understandably, there's going to be, I think, continued vaccine hesitancy in that age group as there is across the population. And our vaccination rates in the 12 to 17 or 18-year-olds is not great. It's probably in the 35 to 40% range now. And another question in the chat was around what's the target? Well, the target is, 80 to 100%, just like it is in adults. We are very concerned about flu, partly because of the rebound that we're experiencing with RSV and the zero rates of RSV that we had last winter, followed by these huge rates of everybody getting RSV at the same time. We're really afraid that could happen with flu. Also vaccine preventable. I'm personally concerned about this lap over effect of vaccine hesitancy from COVID to the flu vaccine. I think a lot of people ignored the flu vaccine or didn't really think of it as something to be worried about. And now because they're worried about the COVID vaccine, they're worried about the flu vaccine. That would be a real tragedy because I'm not sure how our systems can handle the volumes that flu could add to what we're already dealing with. And on top of the months and months and months of dealing with this is a really stressed workforce. And it is not an inexhaustible workforce. It is a workforce that has limits. And when those limits are reached, it will affect everyone, your children, the children in your school district, the children in your lives. Everyone will be impacted. And we are trying to do everything we can to avoid that day.
Dr. Manning, let me give some figures I just pulled up that I actually just got a few minutes ago. In Ohio, those aged 12 to 15, it's almost 38% of them have been vaccinated. Those 16 and 17 years of age, it's 44%. So that's what the numbers are. Obviously, we need to get those numbers a lot higher. This is compared to other age groups in Ohio, it's a significantly under-vaccinated group. Every other age group is going up beyond that and is significantly higher.
Sarah, do we have time for one more? I know we're running out of time here.
One more question, and we will save all of these and be sure to work with your BASA leadership team and follow up questions that were not able to be addressed today. We are being asked if we're able to participate in supporting exit strategies for districts who are enforcing mask mandates. If, what would be the criteria that would be developed to help determine when that can end?
I think the commitment from all of our 6 members to all of you is we're here to partner with you, as the physicians and clinical leaders have said. I know many of you are already currently working with your regional children's hospital. We are happy to continue that conversation along with the public health officials, Dr. Vanderhoff and his team. If I could just quickly summarize, I guess, Governor, I would turn it to you if you have any final thoughts you'd want to share, and then I would just like to recap the action items that I found, and we can share those back to the team. Governor?
Yeah, Nick, I just thank everybody for being on. Thanks to the children's hospitals for doing this, and thanks to all our superintendents and other school officials, again, for everything they've done for the last year and a half. We're very, very grateful.
To the superintendents, we will make this recording available. We help set this up with your respective state associations. Once we've got that recording link available, we will push that back out to all of them. I know we've got folks from parochial, folks from Career Tech, as well as BASA. Secondly, I think we were successful in being able to upload that CEO open letter to all Ohioans, which references much of what we've discussed. Again, if not, we're available to share that with you. We're going to continue, as we talked about, to educate everybody. So certainly we talked about legislators. If the administrators on this call feel like it would be useful to do a similar exercise with the School Boards Association or any other education group, we are 100% prepared to do that, and would love your guidance on how the best way to accomplish that would be. We'll take the chat questions and compile those into an FAQ and work with Dr. Vanderhoff and his team to make sure that the ones that the state answered are captured in there. And we hear you also finally on the data question. The state of Ohio does have on their COVID-19 dashboard an area for schools and children. Some of what we referenced is on there, and we're working to provide more granularity there. But we'll make sure that link is available as well. It's 2:00. I know you're very busy running your own school systems. We can't thank you enough for all the work you're doing to help kids. And please know that you are not in this alone. We're here to walk with you along this path and make sure we can achieve our goal of kids in person 5 days a week in school. And we're grateful for that. Thank you, everybody. Have a good afternoon.